Hi, this is Dr. Mark Thompson and with Dynamic Chiros, and it's really common for us to see patients who get in car accidents, and one of the jobs as me as a provider is to figure out the mechanism of injury. There's a lot of research that's been done that shows that when people are in certain positions, they tend to have more chronic pain after an accident. Probably the foremost authority in looking and reviewing this research and actually doing accident reconstruction is a person called Dr. Arthur Croft with the Spine Institute of San Diego. I've taken his courses, and this is one of his published works. So one of the things I found very valuable in taking his course was you look at all the improper positions that people are in during the accident, meaning it causes more of an injury to the cervical spine or to the thoracic spine or the lumbar spine. And so that begs the question of what is the best position to be in if you're going to be in a collision. So this segment today, coming from the comforts of my own vehicle, is to show you the position if you know that you're going to be hit in a rear impact collision, the optimal position to reduce the amount of injuries to your spine. So a couple different points that they found is if you look in your rearview mirror or you notice, oh, somebody's coming up pretty quick, here's the different positions that you want to be in. So if your head is more than a couple inches off the head seat, the headrest, then you're going to have more of a whiplash effect. So you want to bring your head all the way against the back of the seat rest. You want both hands on the steering wheel in kind of a 10 and 2 position, not this way or that way, so it causes more torquing on your shoulders. You want it to be an equal distribution as you get hit. You don't want a ramping effect in your lower back, and so you want to take your pelvis and push it all the way against the seat back. You want to then, a lot of times what will happen is people will have their head down or they'll have it turned to the side. You want to look straight ahead. And actually what they've said is if you're going to have your head in the optimal position, because I'm in a car where my seat's pretty high, so most people are in a car where it's a little lower, and what you want to do is essentially look 15 degrees up, so a 15-degree tilt up. If you have a head down, there's actually more stress to the cervical spine at the initial impact. So bring your head up at 15 degrees, so just kind of look up at the area of your rearview mirror, but keep your head looking straight ahead. And then you put your foot on the brake and you just push as hard as you can. And then keep your foot on the brake. People think that you need to be loose when you get hit. They actually show that people have more chronic pain if they're caught by surprise, meaning they're all loose when they get hit. You actually want to brace for the impact. And so foot on the brake, 15-degree head tilt, head against the seat rest, and hold on. Hopefully that helps you out.